time for our weekly Healthy Living segment. We have Dr. James Hawley of Southeast Texas Medical Associates joining us now. Dr. Hawley, there has been a lot of talk about the term medical home. What exactly does that mean?
Well, the term refers to a style of practice which is really harkening back to an earlier time in our history, back to the 40s and 50s, really back to Marcus Welby type of healthcare, where we in fact patients are cared for more carefully. The name is really patient-centered medical home. You actually get certified. There's a total reorganization of the practice where everything is focused around the patient. It's no longer the practice building itself, but the practice building the patient.
And why is it called home? Is that more because of the relationship? Or
well, exactly. A home is where you go when you're in trouble. Home is where you know that your needs are going to be met, where you can tell someone your deepest, darkest secrets without fear that somebody's going to sit in judgment of you. A home is where you can go when you have no other place to go. And so that's the concept of a home, where it's someplace you belong and where the people there care about you, they know you personally. The concept of home is integral to the whole concept of how healthcare is going to be delivered over the next 50 years.
And how does a medical practice actually, I guess, transition into being that type?
It's a long process. On our website, there's 50 articles that I've written over the last 2.5 years. Typically, a practice will spend at least 2 years transforming itself into a medical home. It can take longer. Very few people have done it under that. We did it from February 16, 2009 to April of 2010, a little more than a year, but it was a major effort. We put a lot of resources behind it, and we have been certified now for over a year.
And is that with the accreditation too? Can a practice become accredited in the way SETMA is?
Exactly. There are 4 agencies: the National Committee for Quality Assurance, NCQA, the Ambulatory Accreditation Association for Ambulatory Healthcare, AAAHC, URAC, URAC, and the Joint Commission are the 4 agencies now that are accrediting medical homes. SETMA has accreditation by 2 of them, AAAHC and by NCQA. We're going to do the other 2, not because you need them, but simply because we want to be able to compare those and see which is the best and what we can learn from that process. Currently, we're the only multi-specialty practice in the country, that seems novel to say, but it's true, that has both AAAHC and NCQA certification as medical home.
And that's beneficial for both the patient and...
Exactly. Well, a couple of the key concepts of medical home is that we coordinate the care. We make certain that patients understand what they're supposed to do. We give them plans of care and treatment plans where they understand, and they can... We talked recently about the baton, where we hand off their plan of care, we hand off their treatment plan, and we enable them to take charge of their own health care. Remember, there are 8,760 hours in a year, and they're in charge of their care most of that time.
Absolutely, we understand that. This will be on our website as well as on the SETMA website if anybody has any questions to use the phone number and give you guys a call.
Thank you.
Thank you, we appreciate it.
Good.